light of the success Nigeria has recorded in the fight against polio, the Kano state government is focusing on tackling other ailments, despite the state being a breeding ground of poliovirus in Nigeria since the year 1988. TVC News correspondent Ibrahim Isah reports on the journey so far in the fight against the virus.
Since 2012, Nigeria reported more than 185 cases of the polio virus, of which 26 came from Kano State, which has traditionally been regarded as the epicenter of the virus transmission in the country. According to a clinical infectious diseases publication, the number of vaccine-derived poliovirus cases peaked in Nigeria in 2009 with an annual total of 155 cases. Following that surge, 105 cases were reported in December 2017, 33 of which were reported in Kano State. Health officials believe Kano's decision to suspend vaccination in August 2004 led to a quick spread of polio across Nigeria, since Kano is the commercial nerve center of northern Nigeria. The suspension of vaccination then was due to claims that oral vaccines caused infertility and led to the spread of HIV. After a month of negotiations with the president at the period, Olusegun Obasanjo, Kano's political and religious leaders agreed to join the polio campaign. But that again suffered another setback in 2013 with the killing of 9 polio vaccinators while on routine immunization. The incident was reportedly triggered by comment on a radio program and inflammatory remarks against the immunization exercise by some religious leaders. Weeks after the attack, the Nigerian government suspended the operating license of the radio station in Kano. The government concluded that the attackers, suspected to be members of the extremist group Boko Haram, were incited by the radio program, which insisted polio vaccination was designed to reduce the Muslim population. The 2 radio journalists who presented the program were also charged as a result. A fresh case of circulating poliovirus was then discovered in a sewage located at Darmanawa Ward in Tarone local government area of Kano State in 2019. The new discovery interrupted the state attaining a milestone of 3 years of being polio-free. Public health experts say it is sometimes political, traditional, or due to community interaction.
Sometimes if individuals felt that felt need is not to accept polio vaccination, rather they have other things, or they can now try to link up what they want with political, phenomena, and try to see that they want to push the government, trying to do what they wanted.
Bashir Lawan is the Deputy Director, Public Health and Disease Control, and the Incident Manager of Kano State Emergency Operations Center. He took us through the strategies adopted by the Kano government over the years that led to them finally winning the war against the poliomyelitis, spite of obstacles faced.
Kano State was a pace setter, so to speak. Why? Because since July 2014, we are without this scourge of a disease, well ahead the nation as a whole, with several months. And this is not without so many approaches and designed activities by Kano State government.
Bashir Lawan insists that already established protocols shall continue with concentration on non-polio ailments like meningitis and malaria. Somewhere in the heart of the Asian city, days before the declaration that Nigeria was free of the virus, some of its victims had converged to discuss issues relating to their plight. Their resolution was to ensure polio does not again run unchecked in Kano, and no child is ever again disabled by the disease.
If you look at us, you see we are a living example. We are polio victims, so we are giving our maximum cooperation to our nation, because we don't like to see anybody who have a polio in his body.
Ina kira ga iyayen yara kamar yadda dai muka saba
I am calling on the parents to continue giving out their votes for vaccinations so that they will grow healthier and not be physically challenged like we are. The Independent Africa Regional Certification Commission will make its final decision about the region's wild poliovirus status in the month of August 2020. Nigeria would of course be declared polio-free, but these physically challenged here are already affected by it. They are hopeful that parents would continue handing over their wards for vaccination so that people like them would not be available on the streets again. Ibrahim, Isah, TVC News, Kano.